Hey everyone, this is Kara Crossway Brindle. Welcome back to the channel. Special guest with us today. I have Dr. Jeff with us. Hi, Dr. Jeff. How are you?
Morning. I'm doing well. How are you?
Doing awesome. So excited to have you on the channel. Some people were going to recognize your face because you were part of our virtual book fair that we did a little bit ago. So if you recognize Dr. Jeff's face, it's because he's also an author, but he's got a lot going on. So I would love for you to introduce yourself more fully, Dr. Jeff, and let people know what you're up to.
Sure. Excellent. Thank you. Yeah. Clinically, my background is in cognition and personality. I did postdoctoral training at the Beck Institute of Cognitive Therapy and Research in Philadelphia with Dr. Aaron Beck and Judy Beck, his daughter, who runs the institute now, and Dr. Leslie Sokol, who was their personality disorder expert at the time. And I did that specifically to develop our borderline personality disorder treatment program for our hospital. And over the course of those 15 years, we treated over 500 patients with borderline personality disorder specifically, a number of other personality disordered individuals as well, and then also developed cognitive behavior programs for depression, anxiety, addictive behavior disorders, etc. And so I ran those programs, did clinical work for about 20 years until I ended up taking medical leave and I ended up having a kidney transplant.
Mm,
And so during that time that I was off, I sort of got into the personal development and training world, but I also really worked at sort of with a compromised immune system and the pandemic right around the corner. I thought it probably wasn't the best idea to go right back into a clinical hospital setting where sick people are all the time. And so I really started developing sort of my own training programs. I mean, I've been on faculty for educational institutes around the world, but I've never really offered my own. And so this is when I sort of took the time to do some of that legwork. So now I'm primarily doing training, consulting, a few workplace and non-clinical sort of trainings for lay organizations and churches and schools and etc. But still do a hefty amount of my work in clinical training.
yeah, I mean, you're a wealth of knowledge. That's what I think people are getting so far in our video. So I know I wanted you to come on because you have a couple things you're launching, a couple things we want clinicians to know about just to expand their toolkit of things they have going on. What would be those things you want to name?
Yeah, so what I'm doing now is I have taken really the trainings that I used to do around the world when I was a national trainer for PESI and then different institutes in other countries as well. And I've sort of packaged it into one subscription program. I've
Mm,
named it after my first book, so the CBT Toolbox. I've actually got 7 publications, but none of the rest were nearly as successful as that very first book that I really didn't even want to write until I got my arm twisted into it. And that's the one that's sold over 100,000 copies and done way better than any of the others. Um,
amazing.
but so I've named the program after that. It's the CBT Toolbox Professional Provider Program. It's a monthly subscription program. Each month, you get one training, basically an hour-long training on some aspect of the cognitive model. So, cognitive model of depression, cognitive model of anxiety, cognitive model of anger. We do a little sort of off the beaten path. We have an hour training on psychosis. We have a look at cognitive approaches for narcissism. I've got kind of a couple of fun little ones in there, things I'm working on now that are more specific.
Mm,
The role of schema-based validation in empathic confrontation for working with narcissists and other difficult personalities. So some fun stuff like that, but it's mostly pretty mainline clinical stuff. So in the program, you get the 1 hour training every month. You get the tools out of the CBT toolbox that go with that particular symptom set. So providers can have all the resources they need to work with clients on that particular problem area. You can print off as many copies as you want with no copyright concerns to use with your clients. And then also the monthly consultation. So if you have any questions based upon the training, if you're on that live version, you can hop on and I'm happy to answer any questions in that live Zoom call with people. I
amazing.
mentioned I mentioned the live Zoom call. So My company is APA approved and NBCC approved. But in terms of the home study credits, it's only approved for LPCs through NBCC. So if you're any other discipline, you got to make that live training, which is Tuesdays, noon Central Time. So sort of a lunch-ish hour training, depending upon where you live there. But if you're an LPC, you can watch it at 3 o'clock in the morning in your pajamas if you want to. But,
Right.
but the LPC, I mean, the home study credits are only available for LPCs.
Yeah, I appreciate you naming that because I know that's important for all of us who are getting our CEs and have to accrue them for the span of the license renewal. What are you hearing from the folks who are in the toolbox, things they like? I mean, I'm hearing handouts, consultation with you, accessibility. What else would they say?
Yeah, it's just, I mean, I think they enjoy the practicality, just really being able to have the tools hands on. And if they have a question, then they can ask it. Also, I mean, if it's fairly limited, I allow email access. I did have one person kind of barrage me, so I always give the
Mm,
caveat if it's fairly limited. But a lot of times people just have a quick question, and so they can shoot it to me via email as well. I think a
nice.
lot of people will say also, just thinking about the feedback, that they've always said they do some CBT and they sort of knew a lot of this stuff intuitively, but they didn't really have the structure. They didn't really have the sort of the way to go about it in a way that really drives their treatment. And a lot of people
Mhm.
have said, I used to kind of get into sessions kind of thinking, oh, what am I going to talk about with this person today? But once I've got this sort of conceptualization and the roadmap that we teach, I mean, it really drives everything from, your initial thinking about the case to treatment planning to agenda setting in session, really all the way down to documentation. So just to have a more sort of systematic way that's evidence-based. It's proven to work with almost all of these diagnoses. And many of these diagnoses, it's proven to work better than other modalities out there. So I think clinicians just really appreciate that. Actually, one more thing that I've sort of been surprised how often I've heard it, is people saying, oh, I didn't realize that such and such new modality, EMDR, for instance, has all of this cognitive therapy in it. So I think a lot of these newer approaches are actually rooted in
Mhm.
fundamental CBT principles, and some of the newer clinicians in the field that just start by getting some of these other modalities really enjoy sort of going back and understanding the foundational basis that some of these other skills that they were using, where it really came from. So
That's
those are the few
amazing.
of the things that people say.
Yeah, well, as a CBT trained therapist from graduate school onward, I'm intrigued to go in there and learn some more and see how it is integrated into all of the different modalities. Where can people find information on you, Dr. Jeff, and on the program?
Well, it's on my website, jeffriggenbach.com. I'm certainly glad to get you a link. Actually, I didn't mention this, but I have a free 90-minute training for those that haven't seen me or know my style or my content. It's just entitled Cognitive Therapy. It's more than what you think. And so it's 90 minutes, just kind of a state of the union, overviews all the sort of the traditional CBT
Mhm.
and some of the newer offshoot approaches, and gets into a little bit of the schema or deeper level work. And that I don't do a live version of. You just get that if you don't have to opt into the program, but you just get that as an opportunity to take a look at what the program would look like. So that's
Mhm.
only available via home study. So anybody can do it, get the 90-minute training, but you only get the 1.5 NBCC credits if you are an LPC.
Yep, that
But
totally tracks. And
I'm happy to get you the link to that as well for you to share, and
awesome.
people to jump in and get that 1.5 free hours.
Yeah, well, and I love that you framed it as this is a way for them to get to know your style and how you teach and how you explore and present. Because the more I stand in a leadership role here in Colorado, the more I hear people are looking for a certain style of how to like take in information. So I really appreciate and value that you do that. Where you're like, here's what I look like. Here's what it's going to be like if you join the program. I think that's really valuable. Thank you for that.
Yeah, absolutely. I mean, I think it's important. People have different learning styles, and some people
That's
learn
right.
better from different types of presenters. And so it's a good chance for people that haven't seen me to just kind of get a sense of what it would be like if they were to be in the program, and what the content and how it would be delivered.
Absolutely. Well, I'll be sure to link everything below the video for folks who are listening and like, hey, I want to know more. I want to check this out. The 1.5 hour free training to get to know Dr. Jeff or any of his content because you've got a lot going on. You mentioned several books. You have the speaking gigs. You have all these things. So I'm really grateful that you spent time today telling us all the cool things you're up to.
Yeah, I appreciate it. It's always good to touch base with you, and hopefully some of these things will resource some of your audience as well.
Absolutely. If there was one final thought for folks who are watching this video after the fact, what would you want them to know?
I mean, I just maybe to think about the idea that it's important to have a cohesive approach with how we approach clients. I think this is another one of the things that just popped into my mind is a lot of people I think have said, oh, well, I do some CBT, but they were
Mm,
really just pretty kind of do a little bit of this and a little bit of that, but never had a sort of a directed focus with how they're going to approach clients. And I think that's probably the number one thing that people have found helpful is really just to have sort of this is the frontline way that I approach these particular problems. And then it's nice to have these other adjunctive strategies to go to as well. But this is really going to drive your treatment in a way that makes it easy, makes it practical, and makes it beneficial for clients.
absolutely. Well, I always appreciate learning more about what you're up to because I have people in my mind now who I'm like, oh, here's the training they were asking me about months ago. And I was like, I don't know. So excited to give them your content as a resource, Dr. Jeff. Thank you again for being here today. I appreciate you.
Yeah, thanks for having me. It's good to see you.
Absolutely. Viewers, stay tuned for more videos. We'll see you next time.